Hey, this is Lee Welch with the Running PTs. Today we're talking about plantar fasciitis. Plantar fasciitis is pain on the inside of the heel. The hallmark sign of plantar fasciitis is pain first thing in the morning. Typically, this is an overuse injury with a couple other variables that can contribute to this as well. So the evidence suggests that plantar fasciitis takes about 10 months to resolve on its own without treatment. We typically get it better a lot faster than that. There are two types of plantar fasciitis. There are acute and there are chronic plantar fasciitis. Acute plantar fasciitis is basically plantar fasciitis that's in its infancy. This injury responds to rest, but generally has to go through a period of inflammation and then proliferation of scar tissue where your body goes in and tries to heal that area, and then remodeling of that scar tissue. So even when you've got really bad plantar fasciitis in its infancy, it oftentimes takes a period of time of going through the normal course of healing to resolve. I see that period typically take about 3 or 4 months with proper treatment, which typically involves addressing the driver behind the injury along with soft tissue work on a consistent basis. The evidence supports doing manual therapy or soft tissue work for plantar fasciitis. A lot of patients at home will use a roller. You don't want to go too aggressively with that because it can actually make it worse. In the clinic, we do a lot of hands-on work with our hands with a tool called instrument-assisted soft tissue mobilization. Some people call it Graston or scraping. And sometimes we'll introduce light, gentle, dry needling during this stage in the calves and in the plantar fascia itself. Chronic plantar fasciitis we see regularly. This is an individual that's been running through heel pain for a very long time. These injuries typically respond very well to aggressive deep tissue by a PT, dry needling, and then strengthening of the plantar fascia itself. There are some exercises that you can do to strengthen the plantar fascia. I like to introduce those with patients that have been dealing with this for a long time. With both of these injuries, there's typically a run form driver, an overuse driver, and orthotics are usually indicated to allow the tissue to heal a little bit faster. Orthotics will raise the arch up a little bit, which effectively shortens the plantar fascia, which allows it not to be lengthened and stretched out as much while you're running and walking, thus allowing the fascia to heal a little bit faster. I like to coddle this injury in runners when they're dealing with this, meaning I like for them to wear things like 𝘱𝘭s or recovery sandals or slides at home and not go barefoot in order for the injury to respond and recover a little bit faster. On the flip side, I think there's a lot of value in being able to walk around barefoot, being able to be around your house with no shoes on. So as the injury resolves, I typically encourage my patients to get rid of the slides or the 𝘱𝘭s or not wear them as much at home so that they don't lose the ability to be barefoot. There are times where calf and Achilles stretching is indicated with these patients for sure, but I have found that typically these injuries are more overuse in nature and orthotics and run form changes are more important. There is certainly a correlation between calf strength. I typically recommend introducing calf strengthening as a preventative measure. This is a really tough injury to boil down into one video. There are so many presentations and so many different things that you do for different types of heel pain and different presentations of plantar fasciitis. Comment with any questions down below. If you're struggling with heel pain, we can help you. TheRunningPTs.com or email us at info@TheRunningPTs.com.